Hello there, my name is Florian Marcus. I'm a digital transformation advisor at the eStonia Briefing Center. I'm greeting you from arguably one of the most comfy chairs in all of Estonia. And in 4 of the other most comfy chairs, we have 4 very esteemed guests that you've already seen speeches of earlier today. In this first panel, we want to map the current state of eHealth. Now, of course, we have the former president Toomas Hendrik Ilves here, and also the company representatives from Nortal, from Helmes, and of course from Cybernetica as well. I would like to first set the stage, perhaps with you, Mr. President. What challenges do the European and American healthcare systems face at the moment? What are the differences, and where do you see some overlaps where maybe we can also exchange best practices?
Well, I think the challenge for Europe at this point is actually going from individual national solutions and to actually create a common health space. Estonia is the only country, together with Finland, that has digital prescriptions that work across national borders. This should work all across the European Union. So too, so that if I get sick in Brussels, I can take out my Estonian doctor's prescription in Brussels, which now only works if you're a Finn that gets sick in Estonia. But even beyond that, I think what would really create a common space would be if I happen to get sick in, say, Athens, Greece. I go to a doctor, I identify myself and authorize the doctor to look at my medical records, and he will get it all in front of him already translated into Greek, which is it's a no-brainer at this point to do that. So in fact, the healthcare, with all the, who pays for it and all that can be dealt with, but the fact that the information is available across a common space in a secure way is what we should be striving for. Now, in the United States, it's of course, where you have 30% of the population, roughly, from what I understand, is even uninsured, that this becomes a much bigger, more daunting task. The HMO system in the United States, which, for those who are enrolled, works rather well, but what is necessary is to get them to adopt a common standard for data exchange for the same kinds of problems. So if you're from Pittsburgh and you happen to get sick in Oshkosh, Wisconsin, that those data are easily and securely transferable to the person authorized to see them. And so I think in the US we need since there is no national system, there's no real, at the state level, there's no real system. So you need to actually get the HMOs to really begin to create a framework in which to share data.
Just a very brief follow-up there. Do you feel like on a structural level, the US might actually be better set up to solve its own challenges in comparison to the EU, which has to deal more with several national governments on that level? Would you say that's fair?
Well, yes and no. What we do have is, in Europe, we have over the years adopted lots of common standards, which makes the data exchange much easier. We do have a directive that actually mandates every government to offer a digital identity. It's not mandatory, but you
start.
Yeah. So you have that, whereas that's completely missing in the United States. On the other hand, it's clear that private sector cooperation is far more effective than national governments agreeing to things, which is a much longer process.
I would like to start with questions to the company representatives, maybe to the audience from left to right. So to Taavi Einaste first, but also the same question was already sort of touched upon during the Q&A partially. But what experiences have you been able to gather in the US market so far, and what do you think where the Estonian know-how can be most easily or most adequately applied?
Well, I think Again, scale is one of the like keywords I would use. So the massive amount of users that can get on a platform very quickly, once it becomes popular. That has been a very interesting engineering challenge for our team, coming from a country of 1.3 million people. So I think that's one, but that's technical, and that's something you can solve. You put smart people in a room and they come up with a solution. As far as we understand, the huge difference comes from the fact that a large share of the U.S. Healthcare is provided in the let's say insurance-created silos, you could say. Some of the silos are very large. It could easily be 30, 40 million people, and you have huge discrepancies between the quality of the digital ecosystem of those silos. So, we have very good examples from some of those insurance providers who have data is moving between the patients, the pharmacies, the healthcare providers, but you get into the challenge the moment you leave that heavenly space and you want to go to another provider.
How dare you? Yes.
So, absolutely, and I think this is very well reflecting the problem that we have in Europe between countries. So the problems are coming from very different sources, but they're similar. So interoperability at the end of the day is the same. I think that there's hope. What we are seeing is and this is again coming from a technical side, but sometimes technological innovation can help also policymakers and industries to change. So what we are seeing over the last 5-6 years is a interoperability framework called HL7 FHIR, which has gained a lot of traction on both sides of the Atlantic. So we are seeing countries, major countries in Europe following this standard. For example, the German digital prescription, which is hopefully going live soon, is following the FHIR standard, and we see many of the federal agencies involved in the policymaking for the U.S. healthcare. They are also embracing the same FHIR standard. So I think what this enables, it enables companies to build solutions that can work on both markets, and that can be an enabler also for the policymakers, because as soon as the technical tools are available, it's easier for the policymakers to follow through on interoperability as well.
And if I remember correctly, Nortal also helped Germany a tiny bit in the direction of e-prescriptions?
That's true. One of the most successful pilots, was done by us, and we even received a innovation award for that.
It's very difficult to keep that happy face behind. Yes, thank you very much. Meelis, you've already shared some of the insights, but maybe you want to expand on your experience in the US market and the sort of clients that you've worked with so far, and maybe also what you're looking for in the future, what kinds of clients you would really love.
Yeah, so since we're building business critical software and we're focusing on integrations, smart integrations, so as I told earlier, it's not like you don't have to replace often the whole software. You can do custom modules, smart integrations, and the expertise lies in how to integrate this medical equipment with these different systems. And as Taavi said, the medical health standards, how they interoperate, are already there. They are proven. The device manufacturers are providing these devices around the world. There are the similar devices in Europe as in the US. So having this experience, integrating different hospitals, hundreds of different devices with different systems, that's the experience you can take anywhere. So I think these international standards help, and there are so many proven track records of how to do it.
Kevin, would you say that's the same for Cybernetica as well, or have you, because you're coming from a slightly different angle, the data exchange nature, would that be a different experience for you?
So I'd say we view healthcare in the United States as an area that we sort of distinguish in three perhaps areas or layers, starting from the sort of infrastructure or data layer, as has been mentioned in terms of interoperability, making data liquidity possible so that you can exchange it between counterparts that are independent stakeholders, right? They have their own organizational boundaries, a mandate, their own systems, and so on. And usually they have low trust between each other. So that's one area that we look at quite intently in terms of how to enable these trust ecosystems in healthcare and wider in the United States, so that you can actually unlock this data. And the other layer is in intelligence and analytics. Once you have this data available in some sense, you need to have ways of being able to create insights, actionable insights from this data. And in healthcare, this can mean examples in prevention, like if you're able to, in a discrete way, analyze a patient's data, for instance, how their asthma conditions have been treated, you can detect misproper treatments, and by that you can also prevent future sort of repercussions for that individual. And of course, finally, it's this question about creating those sort of applications on top of the data layer and the sort of intelligence that you unlock from there is the applications that actually engage with the citizen, with the patient, and give them this sort of patient-centric experience. So these are areas that we look at, and we sort of try to do this from a larger ecosystem perspective.
Let me just add one thing.
Yes.
Basically, one thing that I think the audience should know is that the technical side of the solutions is the easy part. The policy and political side is where it gets messy. I mean, just the one case of cross-border interoperability I proposed to the Finnish president 10 years ago. And he said, great, let's do it. The technical side of that would have taken 3 weeks at most, if not much less. It took 9 years to go through all of the bureaucratic and political problems that were entailed. So the technical solutions are no-brainers for smart engineers. The problem is to get the policy people and the bureaucracy on board. That's what I would just say for, you guys can come up with a great solution, but unless you get the Congress or your state legislature or your state government on board, even if it's a private sector solution, there's enough legislation in this area to be able to stymie things for a long time.
Yeah.
If I may add, I to a degree agree with the president, but to a degree maybe differ as well, in the sense that technological solutions are easy once someone's done it or sort of shown you how to do it in some sense. Yeah. But I agree that policy and cultural issues are unique to each country. But yet again, information security and principles of information security, principles of privacy, these are relatively standard or relatively universal across different democratic countries. So good solutions that have been developed in other countries can be transferable as long as they are built on the sort of best practices.
This actually brings me to a question that I wanted to ask everyone in the room, and I think we can start from left to right again, just to give everybody a bit more time to think about the answers. Do you have the impression that the different stakeholders in the US, whether we're talking about the patients/citizens, the healthcare providers, the politicians and the legal side and so on, do they share the same concerns about implementing solutions as the European counterparts on this part of the Atlantic? Or do you feel like there is a structural difference in expectations or hopes or fears with regards to healthcare? That would be interesting to me.
My experience, privacy issues are far more important in the European Union, even to an unrealistic degree where people don't quite understand that these have been resolved, but there is a Luddite a priori Luddite inclination among lots of policymakers, especially legislators, because it's a way to get popular. Whereas in the United States, it does not seem to be as important. You just look at the attitude towards GDPR. I mean, the U.S. has HIPAA on healthcare, which is a big step forward. But I mean, this overall concern with data privacy dominates in Europe and not in the U.S.
Yeah. Taavi, your thoughts?
Well, I would definitely agree that I think that the number of cookie acceptances in the European Union has exploded over the last few years. I think it's a different question of how much good it has done. I'm pretty sure that it has had benefits, but I don't think that it has reached the intended benefits. So I think that there's still a way to go. I think in the US the discourse is around a different axis, which is much more concerned about the individual versus state. So you have also the two opposing parties, very different philosophies, and I think many of the discussions also around healthcare solutions, healthcare provision, healthcare financing are stemming from that discussion, which it seems to be steering rather more apart than converging last 15 years perhaps. So I think it's a very different discussion compared to what's going on in Europe.
Very interesting. Meelis, what are your observations?
Well, I'm not an expert on the legal side of things, so I can just discuss from the side of doctors and the administration. So taking these new solutions, especially when they're like innovations into use, it's as with every system, there are like the early adopters and the late adopters, and often the younger doctors are the more enthusiastic, and they try to test and try out these solutions, and this gives kind of confidence. The testing and the working solutions give confidence to others. So someone has to be the early adopter, and kind of give proof and examples how to do it. And then the more senior doctors and the other hospitals can kind of join. That's how innovation happens. So I think it's more about who's the early adopter, and as colleagues said, the standards and the proven methods are there. So, and the GDPR, the data privacy issues, this has been so strong in the European kind of health industry that GDPR didn't change anything in the kind of hospital systems we have built. It was already at this level. So it was just nothing had to change. So all of this can be taken, and it's more about who's the early adopter, who's leading the innovation.
And I think it's fair to say that being the first one is not necessarily, there's nothing inherently good or bad about being first or second. It's just that the experiences are properly shared and assessed, and that we can learn from those mistakes as well. I remember that some of the early Estonian solutions, not just in the health sector but also elsewhere, were simply not built to anticipate such a massive interest from societal side, and you just beef them up for next year. So there's nothing wrong with taking a misstep and going forward from that. Absolutely, Kevin.
Just from the technical side, beefing up, as the president said, technology is not an issue. You can beef it up in 3 hours or 3 days or 1 week. It doesn't take a year. These are counted in days if you put the brains in the same room. So this is not an issue.
I think in general, when we're talking about digitalization, size is not a question also for the implementation stage, because, that's the whole point of technology, to make it scalable, right? So yeah, I think that's usually a moot point when people ask, what does the US have to learn from whether it's Estonia or any other country that is smaller than them, and the other way around, can lessons from the US be taken to Estonia as well? Absolutely, does not depend on size. Kevin?
I agree with the conversation that in the sense that if you build solutions based on best practices and a sort of good policy, and you scale that up, then you get sort of scaled up good policy in this regard. And what we've seen in the United States is that actually quite a lot of people, both on the state level in different departments and sort of and on the federal level, are mindful about privacy issues and data security issues. But maybe the challenge in the United States compared to, say, Europe, is that a lot of this debate is more driven by private sector, which is not a bad thing necessarily. But in some cases, you can see that for the private sector, it's more useful that privacy issues are not at the top of the agenda in the country and top of the legislature. So because their financial sort of incentives are closely tied to that. And that might be a reason why in the United States we perhaps see a bit less of these topics.
Yeah. Taavi, you had a comment, I think.
Well, I think looking into the future and thinking about solutions, one of the important understanding, I think that more and more people are becoming to realize is that privacy is not a one-size-fits-all solution. Mm-hmm. So if you take the general population, you have the people who are extremely liberal with their data, they don't care, and then you have people who want everything to be secret, and then you have a large chunk of people in the middle. So I think that the future privacy solutions, perhaps also regulations, but I think more importantly solutions, you have to have the ability to provide people with dynamic privacy options, and that's a challenge today, but it's doable, and we're working on a couple of concepts to enable this, because I think also the same cookie acceptance, it has really created privacy fatigue. Like it has really done the opposite.
Mm-hmm. Mm-hmm. Mr. President, you want to add something?
Well, I want to say basically, really, if it comes down to the difference between Europe and the US, I would say that Europeans react emotionally to issues on privacy the way Americans react emotionally to issues of a state-issued ID.
Yeah.
I mean, the reaction in both cases ranges from, acceptance and saying this is normal to really wild opposition. But the ID part doesn't bother Europeans, and the privacy part, as we can see, aside from Colorado, I mean, GDPR, which adopted a modified GDPR, it's not been a central issue in the United States, despite, you think it would be. But so I think that's, to understand the emotional component, which, of course, is very important for policymakers who are not going to make decisions if they think it gets people and voters annoyed or riled up.
Absolutely. Kevin, just very quickly.
I just wanted to say, I think the privacy issue actually is quite significant in healthcare, in the sense that if we think 1/6 of healthcare or 1/6 of the GDP in the United States is healthcare, and that's not necessarily a good thing, because this increase over the years has not come from productivity, but just wage increases, meaning that in terms of consumer price index, healthcare costs have been one of the steepest increase. And a large part of why this has been so is that you don't have productivity gains in there, and this stems from also privacy and information security reasons, so that if you're able to actually automate and create this intelligence and analytics from the existing data, you can create step-by-step additional layers of productivity. So you don't need the smartest super AI on day one, but maybe just automate a task that humans do on a regular basis. And that's already a significant leap.
Absolutely. We have around 3 minutes left, and I've got 2 questions for you. So if we can make those 2, you will all get ice cream from me afterwards. You can hold me to this. From the audience, what kind of change, knowledge, or research development would you like to see in the world so that your products could succeed on larger markets? I would just ask the 3 company representatives this. Taavi, if you could mention one thing that would help you boost Nortal.
Well, I think research into how to work with people so that they would make rational choices for their own benefit, which is, I think, a very big ask.
Sounds like education.
But of course, there's a lot of research into different techniques called like nudging, etc., etc. Like, how do we teach people? How do we educate people about the benefit of digitalization, so that they would be more willing to take the journey? Because I think that there's a huge gap in terms of what could be achieved with simple tools today and what people are actually using. And again, like, this is nothing to do with technology. This is social sciences. So I think that's a huge area where we have improvements that can be made.
Meelis, if you want ice cream, let's go.
I think it's like if everybody could learn how to delegate things to the system and just ask for it. Why should any human do stupid work that any machine can do? Learn to delegate to the machines. And as everybody said, technology is not an issue here. It's just ask and it will be done.
It's already
Delegation.
here. Yeah, Kevin.
So I'd say maybe what we see is that if people knew more about information security and sort of privacy, sort of solutions to privacy challenges, then a lot of the sort of backlash or sort of rejection or resistance that we see to these solutions would not exist, in the sense that they would understand that most of the concerns they have in their heads have actually been thought about and actually been solved.
Now, finally, to all four of you, again from left to right, if there was one aspect of the Estonian e-health system that you would like to see both in America and around the entire world, which one would it be?
A digitally secure identity, because not only healthcare.
That's the foundation. That's fair. Yeah. Taavi.
Well, I think interoperability between systems. I think that's key for actually benefiting the people.
Very well. Meelis.
I would go with the same, infrastructure first. That enables everything else and doesn't stop the innovation. So it's an enabler.
Thank you.
I
Kevin.
think we're completely in sync in the sense I agree. Ecosystem sort of level, these foundational enablers.
So there you have it. Thank you so much to all of our panel participants.